Well, hello again, everybody. My name is Marty Guthmiller, CEO at Orange City Area Health System. Welcoming you to the special edition of our COVID-19 community briefings. Today is our 100th community briefing. So because it's a special occasion, I've invited my good friend, Dr. Al Laird, to be with us. Dr. Laird is the Chief Medical Officer at Orange City Area Health System. And so we'll be offering some insight in terms of what the last year has meant to us, the journey that we've been on. And so we'll talk a little bit about that. But first, let's check the box in terms of the statistics that we've been all too familiar with over the last year. So local scoreboard, we have 1,988 positives currently at Orange City Area Health System of the 10,610 tests. So that's one of the things in the future when we look at. We've done over 10,000 tests over this last year. Again, as we've been talking about, more importantly is the local or recent trends. Over the last week, we've had 27 positives of the 152 tests that we've done, a rate that's still at 17%. But again, that's biased a little bit in terms of who we're testing and things like that. But the fact is that COVID is still out there. We're still seeing it on radiological images. We're still seeing it clinically being presented. And so it is still out there. We're not completely out of the tunnel, in other words. Moving into some other statistics then in terms of the county stats, our 14-day average in Sioux County is 5.1%. That has gone down the last 2 weeks now. A week ago it was at 5.4, and a week before that 6.1. So again, 5.1 is our 14-day average. The 7-day average in Sioux County is 5.3. Again, that is going down as well. It was 5.9 last week, 6.2 the week before that. Jumping up to Region 3, again, the 20 counties in Northwest Iowa, hospitalizations today are at 27. And that is down 34 a week ago, 38 2 weeks ago. The number of people in the ICU in the 20 county area is still at 4. It's been there for a long time. Don't know if they're still the same 4 people. Probably, but 2 of those 4 people are on ventilators currently. When we look at the total state of Iowa, kind of flat, 4.9% 14-day average. That's the same as a week ago, which is up a little bit from 2 weeks ago at 4.5. The 7-day average in Iowa is at 4.9%. Again, very flat. Last week was 5.1. The week before that, 4.9. Hospitalizations, and again, this is Iowans hospitalized somewhere, could be most likely in Iowa, but could be anywhere, is 212. That number is up a little bit from previous weeks, 201 a week ago, 192 a week prior to that. Sioux County currently has 0 residents hospitalized. Deaths, again, a signal that this is still out there. COVID is still impacting our lives, up 35 this week in the state of Iowa to a number of 5,857. Now that could still be that the death records are coming in later. That's not necessarily coinciding with actual deaths this past week, but those are the numbers that we have. Sioux County is at 73 officially, which is 1 more than we talked about last week. Again, as I looked at the demographics, no change at all in the demographics relative to deaths. Before we transition into a couple other things, I just want to make sure I mention that our Test Iowa site is still open, is still available, and still an option for you. I believe we had somebody from 30, 40 miles drive down this morning for a test. And so that's Monday through Friday from 8 a.m. to 9 a.m. It's open to anyone. Come in, first come, first serve. and that's in our occupational health and MB1, which is on the west side of our campus. Other options for testing, whether, again, sometimes airlines are requiring a certain test, this and that. All of those options are available through our provider clinic,
yes.
Simply to schedule an appointment. And most likely we could use a rapid test in that environment, but again, that's going to be dependent on the requirement. Exactly. Whereas Test Iowa is a PCR only test at this point. Okay, so that's a little bit of what's going on. We're going to transition now into vaccines, kind of where we're at, and Dr. Laird will offer some insight into that as well. First of all, we've given now over 5,600 doses here through Orange City Area Health System. I don't have the numbers for the county, but my guess, let's say Sioux Center roughly did the same, Rock Valley, 3, 4. My guess is probably 15 to 16,000 doses in the county, which is a very good thing. Closer to home, I can report with much more certainty that 307 of our employees have now been vaccinated, and 90 others have had the virus. Yeah. And so, as again, we're all too familiar with, you're either immune because you've had antibodies, or you have antibodies from the virus itself, or you're immunized and have protection from it. So either way, right now we have right at 400 of our 583 employees protected at this point. And so that's about 70%. 70% happens to be a number that is actually a goal of ours in the county, where most would argue that if you're in that 70% range, you're probably approaching herd immunity. Maybe 75, but certainly you're in the ballpark at 70. And so that's where we are organizationally. And I think that's important for you to understand from the standpoint of the decisions that we make organizationally to protect our staff and public are certainly affected by those numbers. So that's a good number for you guys to know. Interestingly enough, you go, well, how does that relate to the rest of the country, Marty? I say, well, why don't you ask Dr. Laird? No, really, I have the answer to that. And so since I'm talking, I have the ability to ask and answer my own question.
Wonderful.
Yeah.
Excellent.
And so I just read a statement this morning that came out by Becker's Hospital, and I believe this is updated even from the one that I read over the weekend, that Iowa is ranked 13th now, 1-3, in the nation in vaccines, given vaccinations administered at this point. And that number is 783,000 people, roughly. We go, okay, well, that's great. But if we want 70%, how are we doing with that? Well, the answer to that is not very good. Iowa at 13th in the nation is 24.8%. So less than 1 out of 4 Iowans have been vaccinated at this point. And nationally, that puts us in the top 13. So the question becomes then, well, what's number one? Well, the number one state in the country is New Mexico, 615,000 doses given for a rate of 29.4%. So the number one state in the nation right now is under 30%. We have a ways to go before we reach herd immunity. Now, of course, that number doesn't factor in the people that have actually had it, but 50% of our population has not had it. So that's kind of where we are. I only mentioned second in the nation because of its adjacency to Iowa, and that is South Dakota. And South Dakota is 28.3%, but only 250,000 doses administered. So it's a lower percentage, but the geography of South Dakota and the population changes things quite a bit. The other thing that I would ask if somebody were talking to me about this, well, who's the worst? Who's the last? And I looked at the list, and at the end was number 51. I go, the last time I checked, we had 50 states. So, but the DC District of Columbia is in there. So The 51st or dead last state is Georgia at this point. But Georgia has given 1.6 million doses. And so again, that puts things in perspective a little bit. Georgia has given twice as many doses as Iowa. Iowa's ranked 13th, of course, in population matters, but Georgia's at 15.0%. So hopefully that frames the argument a little bit. So we're really encouraging you all to get vaccinated. Call our clinic 737-2000 and you'll get on a list. If we have time, we'll cycle back to a little bit more of that. But I'd like to transition to Dr. Laird a little bit now. And since we've been spending some time on vaccine, what would you call the vaccine a game changer at this point?
It truly has been. And I think it's been an extremely pleasant surprise to me. Marty knows me well enough to know that I can be a bit skeptical at times. And when they came out initially to say that these vaccines, certainly the first two, were 90% effective, that really seemed extremely surprising. Particularly when we looked at the number of people in both the control group and then the people who were in the vaccinated group, there weren't a lot of COVID cases among those folks. And so felt like the predictions might be overgenerous. And yet, initially, the studies that are coming out here in the first few months of the vaccine look very promising, that they're probably going to hold up, if not there, but close to there. And even J&J, who never purported to be in the 90% range, still in terms of hospitalization, ICU, deaths, significant, very severe illness, is probably going to run close to those other vaccines. So it's been truly amazing, both from the standpoint in terms of the development time, which was outstanding and amazing, and again made me skeptical to begin with until reading about how they were developed. And then from their efficacy standpoint, appear to be excellent. Yes, we do hear of people who have had side effects. I certainly had some with mine too. But they were side effects that were expected. And we aren't seeing a ton of unexpected consequences, which are also wonderful. That doesn't mean we know everything. That doesn't mean we couldn't get surprised in the future. But in general, from what we see with other vaccines in the past, you tend to see problems up front, and you don't tend to develop things way down the line that didn't give you a hint. So far, these look very good. And I do have to say, so far, we're just getting an information in now, but extremely encouraged in both the efficacy, the safety, and the rapidity of development in these vaccines is something I haven't seen in my career in medicine before.
And you know, one of the speaking of that, the understanding the risks, and would you like to talk about that just a little bit? Because some of the things, you know, we heard initially about, you know, pregnant ladies or people in that age group, that the vaccine was developed so quickly, you know, and later we learned that it's 5 to 10 years in development in terms of the structure and things like that. So could you just talk briefly about the understanding the risk piece?
Sure, you bet. We all make determinations in our lives based on risk. And sometimes that's very hard for us to put in perspective. So for just a minute, I'm going to take it out of COVID and maybe put it into everyday life. So if I'm going to cross a street to go to the store, there's risks in me crossing the street. That's pretty easy to say. You know, the stoplight, will the car stop? Will I fall in the road? All those kinds of things. But there's a risk if I don't cross the street too. And that's sometimes harder to understand. And that might be I don't get food, or I don't get something I need for home, or so there's risks on both sides of the equation. And sometimes we don't do a very good job of weighing the risk of not doing anything, because that also involves risk. And to not get vaccinated if you haven't had the disease means you remain vulnerable. And so to go get that and take the chance that something bad might happen with the vaccine, albeit extremely rare. There is risk there. But to not do that and then to get the illness, and we certainly know that for younger people, that's why they've been last in line for the vaccine. Those risks aren't probably as big as for somebody in my age category and certainly somebody older than me. But we have certainly seen people who have had those complications. And if I've not had anybody around me who's had COVID, it becomes even harder for me to weigh those risks. So I think we have to keep in mind, we have to weigh the risk of not doing anything. To ourselves, certainly, we have to think about other people as well if I transmit it to them. So I do think weighing the risk accurately is helpful. And as we see more people get the vaccine and see that they're doing okay, I think it helps relieve some of that risk of crossing the street and understanding maybe the benefits of crossing the street outweigh staying on this side and not doing anything.
Yeah, and we certainly understand that there are some legitimate reasons for some people
Absolutely.
not to get the vaccine.
Absolutely.
But in general, to get to that herd immunity, there's tremendous benefit throughout the nation.
Yes.
In doing that. I'm going to try to get a little more techie from my standpoint here and share a screen. And hopefully we can do that. And so what I'd like to talk about is we go back to a year in review of COVID, just a couple interesting stats, and I'll have Dr. Laird relate back to maybe some things that we talked about. But, you know, we've gone through over the last year almost 100,000 surgical masks, 3,580 N95 masks, which are a little higher level mask, almost 20,000 gowns, nearly 1.3 million gloves. So I guess that would be 650,000 pairs.
Yeah.
These gloves comes in individually, and usually we use 2 at a time. But those are all individual gloves there. And 751, not just 750, but 751 bottles of hand sanitizer. Now, the other argument or question here is, well, what were those numbers before? I don't know that. But these just as a snippet of why it's costing us more today to deliver care than it did a year ago because of the PPE requirements. So this has been a real thing. And I'm going to switch back out of this now. And so one of the things that has always amazed me through this time was that originally the goal was to flatten the curve. That people are going to get the virus, people are going to get sick. We just want to preserve PPE. We want to preserve beds. We want to preserve the ability and just flatten the curve so that providers and all of us have the opportunity to care for people. That morphed over several months to, we don't think anybody should get sick anymore. And I'm saying this as a nation, not as Orange City per se, but that we said, we morphed from flattening the curve, letting everybody kind of get it over time, being able to take care of folks, and to, we have to protect everyone from getting sick. And so as we look over the last year and the virus, and maybe even we could get into some lessons learned at this point, what insights might you provide, Dr. Laird?
Well, I did look back as to when the CDC first came out and tried to give us some idea to calculate what you're dealing with, what our calculations were. And when we based this upon Sioux County, they were expecting in a 3-month period of time, if we did nothing, that we were over that 3-month period of time going to have 500 patients that would require hospitalization. And of course, that would be a ramp up, a peak, and a drop off. And so we kind of guessed, would that be like 100 in 1 month, then 300 in a month, and then 100 in another month as it tailed off. And then in addition to that, it estimated that we'd have about 50 deaths during that 3-month period of time using their numbers at that time. If we look at what we did in flattening the curve, obviously, as you shared already, the deaths have been 73 over the year's time. So we may have fulfilled some of that area under the curve. And of course, when we talk about flattening the curve, we're talking about making it last longer, because you take the top and force it down. That means it's going to last over a longer period of time. And I'm not sure how to calculate how many people have been hospitalized. I can see how many people are hospitalized today from Sioux County. I don't have the year's worth of folks to know if we met that number or not.
It would have to be short of that number, I would think.
It would feel like it is.
Yeah.
I don't think we've come close to 500. Certainly just how many we've had here, I'm not sure that we reached 100 with that diagnosis even. So then if we're, you know, we would be more than a quarter of the Sioux County that they would have passed through us one way or another. But at any rate, I don't think we hit those numbers, which is great news, and probably means some of the things we did definitely affect the virus in terms of the social distancing and the masking and the sanitization and all the things that we did. What's difficult to then weigh, because we talked about risks on both sides. There's risks if you don't do anything, and there's risks if you do something. You know, I don't know that we know the unintended consequences economically, emotionally, socially, even health-wise. I'm not sure we have a way to weigh those. I'm not sure that we will know those for years to come yet. But it does appear, number one, thank you for everything that you did out there, because you did flatten the curve. There were times that we got a little nervous here. We were bumping up, will we have to expand into same-day surgery? We got to the point where it was not easy to transfer anyone out of here because our regional hospitals were full. So thank you for everything that you did do, because it made a difference. That there's no question about. How much each individual thing did, that is very hard to parse out. But thank you for what you did. And the fact that when we pull together, good things happen is one of the things I believe we can take away from this.
And yeah, I add my thanks to that too. And you know, one of the things when we were at a point in my career, I thought we'd never see some of the area hospitals actually being full, the regional transfer centers being full. It's not that they abandoned us.
No.
And in fact, we relied on them very heavily. We have good relationships with the docs in those communities, and they helped us provide treatments that maybe we wouldn't have anticipated offering here in Orange City. Again, not that the water was too deep for us to swim in. Right. It's just that we wouldn't have anticipated monoclonal antibodies being administered at Orange City Area Health System. And so do you want to talk a little bit about kind of the treatment advances?
And I think that was what was a game changer in this, and the reason that certainly maybe the death toll and probably the hospitalization wasn't as bad as it could have been. And Marty's exactly right. And I should have talked about that right up front with that. That definitely Sanford, St. Luke's, Mercy, Omaha, all of these folks worked with us to help us learn what we needed to do. Sanford was a tremendous help in terms of providing input. The doctors we could call on the phone there and get information from them, because treatments were changing daily sometimes up there, and for our guidance to keep up with that. So monoclonal antibodies absolutely seem to have made a difference. We're learning which ones are better. We're understanding when to give them. One of the biggest changes for me was when we realized that steroids were indeed helpful. Initially, the recommendation was not to use them because what they had seen in China was they thought it made things worse. And the key seems to be knowing when to use them in the disease, because too early is a problem, too late is a problem. So knowing when, and I think we've begun to understand that. The biggest turning point for me, and this is a feeling, I have nothing scientific to back this on, so indulge me here. But when we began to understand that a lot of the respiratory problems we're seeing may be blood clots and not just the virus itself. When we began to understand we needed to anticoagulate people, particularly when you came in the hospital, and even more so if you went on the ventilator, we seemed to see death rates begin to change. And we saw people not get put on a ventilator to eventually pass away, but people that get put on a ventilator to very likely come off. And then we learned also that if we can drag our feet on putting you on a ventilator and supply you oxygen with other means, and creative means came about to do that, that we could make, again, a big difference in the mortality and the morbidity, the long-term problems with this disease. So we learned a lot. And it's tough to learn that when you're being overwhelmed like they were in New York and Los Angeles and Seattle and those places like that, because you're just trying to take care of people. But as the forces came to bear and we could begin to learn to understand this disease and the complications that went with it, and then begin treatment specifically at those, it felt like we began to turn the tide of the deadliness and mortality and the severity of this disease.
Yeah, and you know, as you're talking about that, it just harkens me back to some of those days where, you know, I saw the team come together. Amen. And the resources that we had and the knowledge base that we had and the ability to implement, you know, there's a sort of nimbleness, as we say, to us here in Orange City. We can adjust and things on the fly pretty quickly. And whether that's our maintenance staff and putting together negative pressure rooms, our physicians and being able to administer new treatments that are not experimental stuff. I'm not saying that, but things that we can implement, proven things right away. You know, and there are plenty of things floating around the internet that, you know, we maybe weren't so comfortable doing. But it was a really good time in terms of seeing the staff come together and seeing everybody pull in the same direction. As we look forward to, this is a loaded question, but you've been warned that it's coming.
Fair enough.
What's the future? You know, one of the things we talked about is none of us have been through a pandemic. None of us have come out of a pandemic. The transition out, I wouldn't say it's as hard as the transition in, but yet it's something to think about. And it is very difficult to transition to the new normal, whatever that might be. So can we talk about the future or maybe even some takeaways if you want?
Sure. Again, I would say, and I need to make it very clear up front, that I'm not an epidemiologist. I'm not a virologist. I'm not an expert from the CDC. So what I'm going to share with you is feelings and what I've read and what I've seen, those kinds of things. But after a year, I think I'm willing to put my nickel down in a few areas. Number one, I think COVID's here to stay. I don't think it's going to go away. We certainly see the 1918 H1N1 flu pop up from time to time. So that flu, once it arrived into the human population, and maybe it had been there before, but at any rate, that flu, once it came, never went away. It just didn't cause the disaster it did the first time as it swept around the world. And so I think this COVID virus is here to stay. And so it's part of what we'll have to consider as treating physicians every time we see someone who's ill. And we'll have to work that into our routines. And 10 years from now, people won't talk about, or maybe study in books, or like the PA students I work with, we'll talk to them about, I'm an old doctor and I remember when the COVID hit. It's now part of the disease process that we have to think about every day. And I do think there'll be ups and downs. Hopefully we have friends who are in France and Europe right now, in Belgium. Both of those countries are going back down into lockdown. Could there be a fourth wave? There's certainly those talking about it. We hope we're ahead of that. We hope the vaccine can beat that. I don't know, but I get the feeling like here, we will see it. And it will come and it will go, and we'll have a few more cases, and then we won't. We'll have a couple people in the hospital and not. I may be wrong about that. I hope I'm not. I hope it's just mild and we can deal with it. And certainly we're blessed to be a little more rural here in this case, because we normally socially distance as Midwesterners more than maybe they do in New York City. Anyway, so that may make a difference. And then it also feels like it'll be less deadly for what we talked about beforehand. We know how to treat it better. We know how to get ahead of it. We know when to use some of these things. We have more treatment options all the time. And so it feels like it won't be the death sentence that it was early on when we didn't know much about the disease. So I think for the future, there's much reason to have hope. That doesn't mean we shouldn't get vaccinated, but I think there's a whole lot of reasons to have a whole lot of hope for the future here.
Good, thank you. You know, and one of the things that we've tried to do over the course of the last year, we've not navigated these waters in the past, but we've tried to rely on an axiom of do right. You know, do the right thing, do it the best you can, and treat others the way that you would want to be treated. You know, and if we do the wrong thing by doing the right thing, then that's okay. Yeah. You know, because we're trying to do it right. We're trying to treat others the way that we ourselves would want to be treated, or the way our families would want to be treated. And we call that basic blocking and tackling too. You know, and that's what we're trying to make decisions from. It's what Incident Command and the COVID Task Force now have been doing from the very beginning. So that's an overlay of how we begin to make decisions and navigate these processes. And we'll be doing the same thing as we navigate out of them for some period of time. And so I want to conclude today by maybe just acknowledging, for those of you that have been willing to stick with us to the bitter end here, some of the heroic deeds that, you know, maybe were acknowledged by the physicians or the chief medical officer in this case, because I think it's important for Dr. Laird to share some observations on what he observed from a physician standpoint on some of these deeds. So do you want to share a few of those?
Sure. And first off, let me tell you, I'm sure there's people I will miss, and so I apologize in advance. But it truly was inspiring to watch people who, of course, on the news, what you were hearing about is we're losing physicians, we're losing nurses to this disease in New York City or whatever. But yet watching our nurses, our nursing aid folks, all the people on the floor say, that doesn't matter. I'm going to put on the PPE and I'm going to go take care of the patient. And they dove into those rooms to give the best care that they could, as much as they could, despite not knowing what it might mean for them or what they might mean for their family. And of course, we took the precautions that we needed to not take it out of here as much as we could and as much as we knew at that time. Having people from environmental services who somebody's got to clean up contaminated stuff. Who does that? Well, people from environmental services, our folks here, they come in, they empty all that stuff, and watching them show me how they close it so they don't blow it in their face and all the things, because I'm not very good at that at home. I take out the garbage and get a big plume of in my face. Those folks that were so good about that, our admissions staff, the extra time it takes to ask all the questions and the hassle that is to you folks that are coming to see us, and the pain with that, and wearing the masks and being inside in a mask all day long is not very fun, but they did it. And so people pulled together, and we didn't have people running away or diving under desks or finding excuses to leave. They stepped up and said, how can I do this? How can I help? What can I do? Maintenance folks, as Marty pointed out, turning rooms into negative pressure rooms overnight, within a few hours, going to the nursing home and doing it when we needed it there. And then the folks in long-term care with all the lockdown that those folks had to deal with isolation of the patients there, ministering to those folks, finding creative ways to try to make communication happen. There's just so many good things that happened that allowed us to pull together. That it is truly a privilege to be part of the Orange City Area Health System. And I'm sure that's true in Sioux Center and Rock Valley and Haywarden and around the nation. Yes, this was tough on people, but it also was a chance to pull together.
Absolutely. Thank you for that. And everybody in our organization, from top to bottom, has pulled together, and that is truly our heroes in performing those heroic actions. So on behalf of all of us, thank you to you folks as well. Now, it kind of seems like maybe these briefings might not continue at this point. I think in terms of a COVID briefing, this probably will be it for a while. But we'll do more briefings in the future. I don't know that they'll be weekly at this point, because after a while, it's probably not of much benefit to you to hear that rates continue to be flat, or non-remarkable. And so we'll see. Future briefings will be there on a need basis. We may do some other briefings that talk about more services that we have to offer here at the health system, maybe explaining a few things or newer things that we're doing. And when we do that, we'll also mention some of the current COVID stuff too. So I'd like to thank you all for your loyal viewing of these. I trust they've been helpful. And it's proven to us to be a good way to communicate. And so on behalf of all of us, thank you for tuning in. And we hope, again, they've been helpful. We ask that you continue to consider being immunized if you have not. Call our clinic again to get that done. We ask you to continue to keep your engine tuned, do all those wellness kinds of checks, and keep the blood sugars in line and the blood pressures at a reasonable level, and get your scopes and your mammograms and all those kinds of things. Keep the engine tuned, because ultimately that's the best way for our bodies to fight those things off. And so, so please do that. So thank you again for joining us. We're going to sign off now, and thank you.
Take care.